anatomical structure of endometrium and uterus. So as you can see, this is endometrial cavity, and you have endometrial glands over here on the lining, in the lining of the uterus, which is also called as the endometrial lining. So wherever these glands are, it will bleed cyclically, which are also called as periods. So they are always under the influence of hormones and they bleed. Now wherever they are present, they will bleed cyclically like periods. For example, if you get in that endometrial glands in the nose, now nose will bleed cyclically, though it's a very bizarre example I have given, but that's what I mean. It's to make you understand. Like if it's on your finger, endometrial glands will bleed there, because they are supposed to bleed cyclically under the influence of hormones. Now when they are inside the wall of the uterus, which is also called as myometrium, such condition is called as adenomyosis. Now whenever there are periods, wall will bleed, because wherever the endometrial glands are implanted, that area will keep on bleeding, and now that obviously there is no way out for that blood, so blood clot formation will be there, and it's cyclical. It gives the patient cyclical pain and definitely intermenstrual bleeding, because whenever blood gets a chance to get to the endometrial cavity and come out from vagina, it will be there, but you cannot detect the exact timing when will it come out. Okay, now when this endometrial glands reach ovary by any chance, this is called as endometriosis, and this is very painful for the patient. So endometriosis means endometrium like, eosis means like. So if ovaries have endometrial gland like activity, then that's called endometriosis, and blood collection will be there, and lot of old blood, hemorrhage, everything will be there, and that gives an appearance of a chocolate ball. So when hysterectomy is done, like uterus is taken out during the operation, and you cut open the ovary, you will see that there is like chocolate like content, and that's old blood, nothing else, old blood. So ovaries may endometrial glands are endometriosis, and in uterus wall, in myometrium it is adenomyosis, and endometrium it's absolutely normal.